This Integrity session is on stress and adaptation. Stress is defined as any disturbance in a person's normal, balanced state. It is important to remember that stress is a response by a person to a stressor. The stressor being that thing that precipitated this imbalance in that person's normal life. Stress can be either negative or positive, and therefore can be harmful, or it can motivate a person to do better. There are 3 types of stress, or categories of stress. Distress is that negative stress. This would be having an illness, having a financial crisis. Although it is a negative stress, it can improve the person's life to the positive, because it makes them better adaptive to a crisis. Eustress is defined as a good stress, but it's important to know that even things like the birth of a new baby, a marriage, a new job, can still stimulate that general adaptation stress syndrome, and so the person still experiences those same physiological responses to stress. Developmental stress are those things that are associated with maturation and growth. This would be the babies being born, first time going to kindergarten, first time going to school, high school graduation, college graduation, getting married, having a baby. Again, those things that are associated with as we mature. Again, these are still stresses, and so these are still things, stressors rather, and so it can bring that stress reaction. Other categories of stress would be situational, physiological, and psychological. The main gist that we'd like to cover today are those coping mechanisms. How do we deal with stress? Again, we said that stress could be harmful or it could be motivating, so it could be growth related. It depends on how the individual deals with it or copes with it. So coping depends on 3 things. People can choose to alter the stress, to change the situation. So if the stressor is the boss at work, that person can quit that job and get a new boss. They can, rather than change the situation, they can change themselves, so they can adapt to the event that's causing the stress, which would be the stressor. Changing their attitude about something that originally caused them anxiety. Or they could avoid the stressor. This wouldn't be changing jobs. This might just be quitting altogether. Maybe a retirement would be avoiding the stressor. Other styles of coping strategies. The healthy management of stress would be adaptive. This would be such that the person would respond to the stressor and they would come out of the crisis being stronger, having changes in the way that they react in the future. These are considered, again, healthy, and because in the long term they directly reduce negative effects of these stressors in the future. Maladaptive, mal meaning bad, maladaptive stressors or coping strategies are, on the other hand, unhealthy. This would be becoming an alcoholic, turning to narcotics, overeating, maybe even becoming violent. Not the recommended response to the stressor. Adaptation is defined as that desired outcome of stress. So this is the opposite of the maladaptive. This is that positive reaction. The person is changed for the better. And so it is hopefully a permanent adjustment to that stressor. This is part of the developmental process. It's also part of maturing and dealing with conflicts that arise in our everyday life. The ability to adapt, again, which is what we want to encourage in our patients to come to that healthy response to the stressor, depends on the intensity of the stressor. If it is the death of a child, it would be more difficult to adapt to than maybe a temporary change in jobs. The effectiveness of coping skills. In our class, we are learning how to manage stress, especially that stress that arises from test anxiety, the test taking. So learning that tests are a part of the nursing curriculum, and that there are strategies in order to manage the test, to manage our study skills, our acquisition of knowledge, and so that once we learn how to adapt, it becomes a permanent way of dealing with those tests. This would be an effective coping skill. Also, our personal factors, those things that each individual brings to the table, has a lot to do with their nature, their individual personality, but also their nurturing environment. What things did their community and family encourage as part of their adaptation? So again, factors that influence adaptation: personal perception of the stressor. Remember, perception is that individual's idea of what is real. So, do they have a realistic picture of the legitimacy of the stressor? And have they had previous adaptation attempts that were not maladaptive, that were healthy? Also, the overall health status of a person influences how they adapt. If they have a chronic illness or they have a series of acute illnesses, they may be physiologically less capable to adapt to these new stressors. Other things that influence positive or negative adaptation are the support system. We talked about that nature, nurturing environment. If you have a family or a circle of friends who act as a family, if you have enough financial benefits, if you have emotional reserves, if you have physical help, those things all lead to better adaptation versus that person who feels isolated and maybe in a toxic relationship. They would be less likely to adapt in a positive manner. Personnel factors we talked about could be the age, the developmental level, and more importantly, I think those life experiences. If you've had success in the past, whenever a crisis arose, then your expectation is that you will also be successful in adapting to future crises and future stressors. The thing I'd like most of the students for this fundamentals and competency foundations for health sciences to come out with is an understanding of Hans Say's General Adaptation Syndrome, GAS. Say described the whole idea of the stressors and that our responses to stress would hopefully be a positive adaptation. However, he said that there were alternatives. So that when we first encounter a stressor, we go into an alarm reaction, which is primarily the physiological results of the sympathetic nervous system taking over. Once the danger of the stress has passed, The parasympathetic nervous system takes over and begins to bring the body back to its homeostatic, steady state. If this parasympathetic activity is effective, the person enters the recovery stage, and in that stage they are now changed because they have adapted well to the crisis, and so they've grown, they've developed, and they're more likely to overcome future stresses. On the negative side, if the person did not adapt, they enter into stage which is called exhaustion, and this is where the alarm reaction occurs, so that the person is constantly under the barrage of these sympathetic responses, and so they may develop chronic hypertension, those cardiac diseases that may even cause their death. So, Say says that every person must adapt to stress. Hopefully it will be a positive adaptation, which is recovery, that people adapt to distress, but also eustress. Remember, eustress being that happy type of stressors. And again, that there are those 3 stages. The 3 stages could be a positive result, with the 3rd stage being recovery, or a negative result or maladaptation, where the person ends in exhaustion. So I'd like to look at each stage, and I'd like to primarily look at the autonomic nervous system responses. Alarm stage. This is sometimes called the fight or flight stage. So this is where the individual recognizes that there is a stressor and that it appears to threaten their homeostasis. Immediately the hypothalamus recognizes that the person has encountered a stressor, and the hypothalamus then sends CRH, corticotropin releasing hormone, that stimulates the pituitary gland. The anterior pituitary gland then secretes ACTH, which is adrenal corticotropin hormone, which will act to stimulate the adrenal cortex, which are the adrenal glands located on top of the kidneys. The posterior pituitary gland secretes an antidiuretic hormone, or ADH. ADH works to hold on to the body's fluid volume in the blood. This action increases the blood pressure, which also increases perfusion of all the tissues of the organs, which will be beneficial if the individual has to indeed engage in fight or flight. They will have more energy reserves, because the blood pressure will increase the circulation of blood, which increases the amount of oxygen and nutrients available to the brain as well as the skeletal muscles. The adrenal glands, once stimulated by the ACTH, which remember was secreted by the anterior pituitary, the adrenal glands secrete cortisol. Cortisol stimulates gluconeogenesis, which again is the metabolism of glucose from sources that are usually held in reserve by the body. The idea is to hold the readily circulating glucose only for the brain, which would need to be more increase our mental acuity to allow us to be smart in our avoiding this stressor. And so other sources of glucose are diverted to the skeletal muscles. Protein is converted into glucose. Fat reserves are converted into glucose, and glycogen stores. Remember, excess glucose is usually stored by the liver as glycogen unless it's required. And now this cortisol calls in that rainy day, right? And so now the glycogen is being converted to available glucose for use of energy by the skeletal muscles. So again, remember, the hypothalamus stimulates the pituitary gland. The posterior pituitary secretes ADH, which increases the availability of water for the body, and so we're not going to eliminate water at the urinary system. That increase in water increases the blood volume, increases the blood pressure, which in turn increases the perfusion of blood to all of the organs. The anterior pituitary secretes ACTH, adrenocorticotropin hormone, which indeed stimulates the sympathetic nervous system because the adrenal cortex then secretes epinephrine and norepinephrine. So, norepinephrine, epinephrine secretion by the adrenal cortex now cause these symptoms. And this is what we usually recognize as the stress response. And this is called the alarm stage in science, general adaptation syndrome. The cardiovascular system is a result of epinephrine and norepinephrine. The arterioles are constricted, and this increases resistance to the flow, increases the blood pressure, as we talked about, again with increased blood volume. Increased blood pressure increases perfusion of the organs for oxygen and nutrients. The respiratory system, the bronchioles and bronchi become dilated, are bigger, and are able to increase the depth of each respiration. In addition, the respiratory rate increases. And so with that increased blood pressure, the need for oxygen has increased, and now the respiratory system can compensate. Metabolic changes, again, remember the cortisol increases the availability of glucose to the brain by converting other sources such as protein, fat, and glycogen into glucose. The urinary system is not stimulated by the sympathetic system, and so that the kidneys tend to hold on to water. Aldosterone is secreted by the adrenals, which will hold on to sodium as well. Wherever sodium is retained, water is retained. So now we have an even greater increase in blood pressure, increase in blood perfusion. The GI system does not respond positively during the sympathetic phase. It's more of an activity of the parasympathetic, which we'll talk about in the resistance stage. On the musculoskeletal system, there is increased blood flow to the muscles. Again, so now that glucose can be converted to energy to allow us to run as fast as we can. If we are successful in avoiding the negative impact of the stressor through our activities generated by the alarm stage, so that our heart rate increased, blood pressure increased, our respiratory rate increased, our availability of glucose increased. We also have the dilatation of our pupils so that we can see better, and again that glucose increase to the brain so that we are mentally sharper. If those factors have led to us being successful in avoiding this stressor, the dangers, we then enter the resistance phase. Resistance phase is predominated by the parasympathetic nervous system. Remember, parasympathetic neurotransmitter is the acetylcholine. So this is trying to bring those accelerated vital signs back down to our baseline. So the goal of resistance is to maintain the homeostasis, how we were before the stressor became evident. The ability of our coping mechanisms, both psychological and physical, help us to return to normal. It is that failure to adapt, that failure to return to normal, that could lead to those negative consequences. However, if our adaptation is positive, we will go into recovery. So exhaustion, this is a maladaptation. Again, this could lead to a chronic sympathetic stage where we have initially a decrease in blood pressure, but eventually an elevation in blood pressure, pulse, respiration, and at some point our heart becomes weakened because it's overworked, and that indeed would lead to following a decrease in all the vital signs and eventually death. If our adaptation was successful, however, we not only return to our baseline, but we are better, we are stronger, because now we have experience with coping. I don't want to really talk so much about the local adaptation syndrome. It's just a smaller response to stress. It's involving not the whole body, but maybe a specific organ, an injury. I do want to talk about the inflammatory response. So remember, there are 4 cardinal signs for inflammation, and my mnemonic is RSVP. So R is for redness. When there's an injury to tissue, the complement cascade comes into play, where those basophils secrete histamine. Histamine increases the capillary ability to diffuse particles through its membrane. Blood cells are rushed to the area. They leak through those capillaries into the tissue, bringing protein, oxygen, as well as white blood cells in order to phagocytize if there are any infectious agents. So all of those things happen, rushing blood into the tissue. Because there's a large accumulation of blood, we now have swelling. And the swelling has a protective effect, because now if there is an infectious agent in that area, it's captured by the swelling, so that it will not become a general adaptation. It remains local, and so that those white blood cells can now come to that area, phagocytize them, and eliminate the stressor. So we had redness, we had swelling, both as a result of that accumulation of blood. We also have the V being fever, so we will have a warmth sensation, again because of the accumulation of blood, but also because of the secretion of pyrokines, which are, again, chemical neurotransmitters that warm up the area to make it less hospitable for this invading agent. If the temperature in the area is greatly elevated, this indeed might cause the demise of that infectious agent. And finally, we have pain. So RSVP, redness, swelling, V for fever, and pain. Pain being a protective mechanism for the individual to alert them that some kind of injury has occurred. We have those psychological responses to stress, which could be feelings, thoughts, and behavior. And again, as a nursing student, most of us recognize anxiety. Remember, anxiety is a generalized state of concern where there's not a specific threat. There's this uneasy feeling that something isn't right, but the individual cannot pinpoint the source of this uneasy feeling. Fear, there is an actual, or at least a perception of an actual threat, and the person can verbalize what that specific stressor is that's causing them fear. Okay. Again, continual stressors, these things may lead to the maladaptation, and this would be the person's demise. Okay. There are things that we can do to reduce stress. The fundamental thing is to understand that by doing some of those parasympathetic activities, we can trick, if you would, the brain into no longer secreting those stress hormones and cause the adrenals to indeed secrete acetylcholine. Acetylcholine, again, if there is no real threat, then reduces the blood pressure, reduces the heart rate, reduces the respiration, and brings us back to homeostasis. Some of the things that are recommended to build our reserve for coping are to eat adequate nutrition, exercise regularly, and get 7 to 8 hours of sleep per day. Other things, making sure to make time for leisure activities, balancing your responsibilities, good time management, avoiding those negative coping mechanisms such as increased ingestion of alcohol, caffeine, sweets, smoking. Other things would be, for instance, yoga for stress management, humor, anger management, doing those kinds of, again, exercises, visual imagery, guided imagery, where you are mentally causing a calmness in your body, and again, the hypothalamus responds to that and fails to secrete those stress hormones. The final result would be a change your perception of the self, which would induce a greater ability to experience and respond to stress. So again, we want to change the perception of the stressor. We want to get adequate support systems to help us to deal with the stress. Spiritual or religious support has been shown by research to help individuals to become better able to deal with crisis. Okay, so again, this integrity session has covered stress and adaptation, stressors being the source or the event that causes the crisis, stress being the response the individual makes. According to Han Say, we can actually categorize stress by looking at 3 different stages. We have the alarm stage, which corresponds with the sympathetic response, which is caused by those adrenal cortex hormones, primarily epinephrine, norepinephrine, and cortisol. We also have pituitary gland, which secretes ADH. We have the aldosterone, again, that comes from the adrenals. Both of those increase fluid. The ADH primarily holding on to fluid itself, aldosterone holding on to sodium, which in turn holds on to fluid. Both of these increase blood pressure and increase the perfusion of the organs with necessary oxygen and nutrients. The second phase, if we have successfully negotiated through the crisis, would be recovery, where the parasympathetic response, guided by acetylcholine, reverses that increased heart rate, increased blood pressure, increased respiratory rate, and this in turn lowers our vital signs. But it also helps us to get rid of that excess water because it stimulates the urinary system and the GI system to metabolize food, but also to get rid of the solid waste as in the GI system and the liquid waste from the blood in the urinary system. If our coping was effective, we will indeed have adapted to this crisis, to this stressor, and we will enter into the recovery phase. If our adaptation was maladaptive, we will enter into the exhaustion phase. And remember that exhaustion, according to Say, leads to these chronic physiological results, initially an elevation in blood pressure, but finally a decrease in all of our vital signs as we approach death. Thank you.